The third question you should ask yourself would be about the ascending tracts. Which ascending tracts passing through the pons? So hopefully you remember that in my previous videos I showed you some ascending tracts passing through the brainstem, specifically the pons. So imagine that we have the first order neuron here outside spinal cord. The cell body would be here into the dorsal root ganglion, and then it's getting into the dorsal white column, and it goes up through the spinal cord like this. So it goes up and then getting into the gracile and cuneate nuclei into the medulla oblongata and synapsing onto the third order neuron, the second order neuron, and then the axon of the second order neuron exiting the gracile and cuneate nuclei and decussating into the medulla oblongata, and then it goes up, passing through the pons and make the medial lemniscus. This is the medial lemniscus. So medial lemniscus goes up and synapsing onto the third order neuron within the thalamus. This is the thalamus, and then it goes up into the third order neuron getting into the somatosensory cortex. So now here within the pons we have medial lemniscus. It would be here. So we have medial lemniscus. So medial lemniscus are positioned from medial to lateral, in addition to the positioning dorsal to ventral. So it positioned dorsal to ventral into the medulla oblongata. But now here is the position has been changed, it's rotated. So this is the medial lemniscus. And what else? We have another ascending tract passing through the pons. It's called spinothalamic. As its name suggests, it starts at the level of the spinal cord, goes up, passing through the brainstem, and getting into the thalamus. That's why it's called the spinothalamic. So the first order neuron would be here. So into dorsal root ganglion like this, and then it's getting into the dorsal horn of the spinal cord and synapsing onto the second order neuron, and then axon of the second order neuron crossing the opposite side and landing here, ventrolateral white column, and it goes up like this and passing through the brainstem, like medulla oblongata, pons, midbrain, and then getting into the thalamus and synapsing onto the third order neuron into the thalamus, and then third order neuron goes up to the somatosensory cortex of the brain. So here we have, just next to the medial lemniscus, here we have another ascending tract like this. It's called spinothalamic tract. So medial lemniscus carrying the specific sensory information like fine touch, and it's also carrying the conscious proprioceptive from the skin, from the joint and muscles, whereas the spinothalamic carrying the pain and temperature from the skin of the body, except the face and head, to the somatosensory cortex. So we have these ascending tracts here. So the fourth question you should ask yourself would be the nuclei. Which nuclei we have here? So I'm going to show you the nuclei in the brainstem model. This model is the brainstem model. So you can see the brainstem from the anterior view. At the top we have the midbrain. This fat guy is the pons, and down here we have the medulla oblongata. So I'm going to focus on the pons this session. So you can find the cranial nerves related to the pons. This is the cranial nerve 5, trigeminal nerve, which is coming off from the lateral side of the pons. It's a chunky nerve, and down here between the pons and medulla there is a depression. It's called pontomedullary fissure or sulcus. From this sulcus we have cranial nerve 6, 7, 8. They are coming off from the sulcus. From medial to lateral you can see cranial nerve 6, abducens nerve, 7, facial nerve, and 8 is a vestibulocochlear nerve. So you can find the nuclei related to these nerves into the pons. So if you look at the posterior view of the pons, on the posterior view of the pons, you can see this diamond shape area. It is called fourth ventricle. Here is the fourth ventricle. So the upper half of the fourth ventricle is at the back of the pons, this area. So if you look at closely, you can see some nuclei. This nucleus is abducens nucleus. It's one of the posterior medial nucleus, which is positioned posteriorly, just a little bit lateral to the midline. So you can see abducens nucleus, cranial nerve 6. A little bit up here we have two bumps. It is called trigeminal nuclei. You know, trigeminal cranial nerve 5 has two nuclei, sensory nucleus and motor nucleus. So sensory is really long, and it has 3 parts. In the medulla I showed you in my previous video the spinal trigeminal. At the pons we have chief principal or main sensory nucleus, and in the midbrain we have mesencephalic nucleus. So this is the chief nucleus, chief sensory nucleus of trigeminal. Just medial to this we have another bump. It's motor nucleus of trigeminal. Chief sensory and motor nucleus, they are just beside each other. And motor nucleus of trigeminal is one of the anterolateral nuclei, motor nuclei. Anterolateral is positioned anteriorly and laterally in comparison to the posterior medial abducent nucleus. A little bit down here, if you look at closely, there is another bump hidden here. It is facial nucleus. It's motor nucleus of cranial nerve 7, facial nucleus. So, and this more lateral, we have this diamond-shaped nucleus. It is vestibular nucleus. So vestibular nucleus is related to cranial nerve 8. So you can find chief sensory trigeminal nucleus, motor trigeminal nucleus, cranial nerve 5. This bump is abducens nucleus 6. Here we have the facial nucleus, and more lateral we have cranial nerve 8, this diamond shape, vestibular nucleus. So as I showed you on the model, we have different nuclei. We have posterior medial motor nuclei. So when I say posterior medial, they are positioned a little bit at the back. So they are just next to the fourth ventricle and slightly lateral to the midline. This is the midline. So here we have posterior medial motor nucleus. It is called abducens nucleus, cranial nerve 6. So abducens nucleus contains some neurons. They are supplying the lateral rectus muscle of the eyeball. So it's responsible for the abduction of the eyeball. So it's moving away from the midline, So this is the abducens nucleus. Another motor nucleus is anterolateral. It is a little bit positioned anteriorly and laterally. It would be here, so like this. So it's called facial nucleus. Again, it is motor nucleus related to the cranial nerve 7, facial nucleus, and it contains some neurons. They are supplying the facial expression muscles. That's why it's called facial nucleus. Another anterolateral motor nucleus is positioned here, like this. So it is motor trigeminal nucleus. You know, as I showed you on the model, we have two trigeminal nuclei, sensory and motor. This one is a motor trigeminal nucleus related to the cranial nerve 5. And so it's motor. The neurons are supplying the muscles of mastication related to the chewing. So these are the motor nuclei. What about the sensor nucleus? Just next to the motor nucleus of trigeminal, a little bit laterally, we have sensory nucleus here. It is called chief or principal or main sensory nucleus. So this is sensory. It is a little bit lateral. So sensory nuclei are positioned more lateral. So here we have the principal sensory nucleus of trigeminal, which is related to the touch. It's coming from the skin of the face, carrying the specific sensory information related to the touch of the skin of the face. The most lateral here we have another nucleus. It's called vestibular nucleus. It's related to the cranial nerve 8. Vestibular nucleus related to the balance. It's connecting to the inner ear, related to the balance. Just keep in mind, this abducens nucleus make a visible bump on the floor of the fourth ventricle. So it's called facial colliculus. Why it is called facial colliculus? Because this facial nucleus contains the facial neuron. So the axons coming out from here and then passing back and wrapping around the 6 or abducens nucleus, and then before it's coming out like this. So if you look at here, facial nerves or facial neurons, they are wrapping around the abducens nucleus and make a visible bump here. That's why it's called facial colliculus. Facial colliculus. So facial colliculus is formed by the facial neurons which are wrapping around the cranial nerve 6 or abducens nucleus. So if you look at here, as I showed you on the model, this is the posterior view of the pons, and you can see this bump is the abducens nucleus. On either side, you can see this visible bump here, which is formed by the facial nerve, which is wrapping around the abducens nucleus. It's called facial colliculus. So you can find this bump or facial colliculus on the floor of the fourth ventricle. We also have the autonomic nucleus here. Just a little bit lateral to those nuclei, we have autonomic nucleus. It's associated with the sympathetic neurons, and you can find it just here, just lateral to those motor and sensory nuclei. So I showed you different parts. If you look at in the bottom line, the more anterior, we have descending tracts here. At the back, we have ascending tracts. Just posterior to the ascending tracts, you can find the nuclei, different nuclei related to the cranial nerve 5, 6, 7, 8, and autonomic nucleus. And finally, the most posterior one is the space, which is called the fourth ventricle. On either side of the fourth ventricle, you can find the MCP, medial cerebellar peduncles, that are connecting the pons to the cerebellum. Now it's time to test yourself, test your knowledge. The question is that which structure within the pons is responsible for relaying information between the cerebrum and cerebellum? A. Medial lemniscus, B. Pontine nuclei, C. Vestibular nuclei, and D. Trigeminal nucleus. Please watch the full video before answering the question, and then put the answer on the comment box and receive the correct answer. I'll put the correct answer 24 hours after uploading the video on the channel. Thank you so much.